Welcome to NCPDP Unscripted, the podcast where healthcare meets real talk. Each episode, we will dive into unscripted conversations with industry leaders, changemakers, and innovators, discussing the challenges, breakthroughs, and behind-the-scenes stories you won't hear anywhere else. Whether you're on your morning commute or taking a break between meetings, settle in because it's time to get unscripted.
Katie, I'm so excited to be chatting with you today. I want to talk about a couple of different things. One is public health, and the other one I want to touch on the Emerging Professionals Fellowship, because I know you just did that recently. But before we get into it, can you tell our listeners who you are, who you're with, and kind of what your involvement is at NCPDP?
Yeah, my name is Katie Russell, and I work for CoverMyMeds as the manager of Data Standards and Interoperability. And I am involved with NCPDP in a lot of ways, and it's shifted and changed over the years, which is one of the things I love about NCPDP is you can be as involved as you want to be. I started out attending virtual work groups, actually, and was so confused. It was like, what's a DERF? I don't understand this at all. I'm not that technical. I feel like my strengths lie more in relationship building and understanding how to solve problems that work for everyone, or at least everyone can find value in. And I was lucky enough that, that actually slots in well at NCPDP as well. You don't have to be a technical expert. You can be someone that convenes other people that have all the knowledge as well. Along the way, I've developed expertise. I actually just took and passed the script exam, so I'm certified in the new version. So that was exciting as well to be like, I do have some knowledge here, but I really have enjoyed a lot of the committees and task groups that I've been a part of. From the start, I've led the EPA task group now for almost 5 years and have led it since we asked for the new standard to be named, and now are really thinking about what's next. And I think that's where my brain goes a lot of the time, relating back to the things I care about and in my career of population health and what can we do to make things a little bit easier for more people. So my interests, and some of them align to my company at CoverMyMeds, like the electronic prior authorization task group, but some are ones that I also really have an interest in personally, like the health equity task group, and thinking through how pharmacists can utilize the data that they have to augment the skills that they already have as population health experts. And most people that know me know I'm an open book and I love to talk about anything. So I also have enjoyed learning lots of new areas at NCPDP as well. The hospice task group that I've taken on ownership of has been really interesting to understand, and thinking about, our most vulnerable populations. How do we assist them more? How do we assist the people that are helping them more? Mm-hmm. There's a lot of different prongs. Ultimately it's about the patient, but it's also about making the people that serve the patients' lives easier.
Well, first of all, congratulations on your script certification. That's super exciting. So tell me, I know you have a master's in public health, mm-hmm. and I'm getting a master's in public health, and that's one of the things that we really connected over.
Definitely.
So how is it that your training in public health has really impacted what you've been able to do at NCPDP?
Yeah. I started out in undergrad, as I think many people do, thinking they were going to be a physician, and quickly learned that being a physician was not the only way to care for people and help people. And the first college professor that I ever had was incredible, and she became my mentor, and I'm still close with her. And she had her master's in public health, her doctorate in in public health. And actually, when I was a senior, they started actually getting a bachelor's in public health. And I was really interested in the intersection of the things that I cared about really with relationship building. So my undergraduate research was in narrative research, actually on stigma within the HIV population, and understanding how the stories that we tell about ourselves impact our actual health outcomes of illness. And I think that public health to me was so vast that it was exciting that I could find lots of different things that I care about. And over the years, I've said a lot of things when people get into roles that they're like, oh, I might not really love that subject matter. And I think I can be passionate about a lot of things because there's a lot of different ways to make improvements for people. But with that work in the people living with HIV population, and then getting my master's, I just really cared about the patient, and I try to always bring it back to that. At that center, in a lot of ways, like a pharmacy, was a place that people could go and get their medication refills, and very progressive in the way that people thought. And I think the way that the pharmacy model has shifted and changed is a lot like that too. And I think with, my public health background, really I think about the population and what are the small changes that we make that maybe, in my company affects thousands or millions, but then if we standardize it across other companies, how it affects the whole population. And I think that's really exciting to think about.
Yeah, that's really great. And I think it's a good point, too. It's kind of interesting how that's what you focused on as in your undergrad, right? And then when you look at today and how pharmacists are really moving into HIV prophylaxis, too, and being able to provide that care that's needed, and what a huge impact on public health that has been, right? Mm-hmm. So what other ways do you find that pharmacists really do impact public health? And then how can you connect that to what we are all working on here at NCPDP?
Yeah, I think, and I know on your podcast other folks have named too, that pharmacists are the most accessible healthcare provider, yep. Right? They're by and large, the most geographically represented, the people mm-hmm. that the healthcare provider that patients see the most, right? Yep. And there's lots of different ways that pharmacists can help, right? Like a lot of times when people think of pharmacists, they think of the retail pharmacist at the counter. And mm-hmm. if you try and put more work on those already burdened folks, mm-hmm. that's hard. Yeah. But there are other people with pharmacy expertise who may have previously worked at the counter, or who sometimes work at the counter but collaborate in other ways, who can make programmatic change and do medication therapy management, develop care plans for individuals, but even noticing medication gaps in care or answering questions. Pharmacists are experts in pharmacology. They mm-hmm. understand that and can explain it to people. And pharmacists have really embraced community health workers. And I think that that's really important too, mm-hmm. If you're a member of your community, you know what your community needs, and you can better assist people when you have relationships with them. I think sure. that's my thread through my career as well, right? Like when you try to really understand the problem, that is what matters. I remember actually when I was getting my master's in public health, we read The Spirit Catches You and You Fall Down, which is a fantastic book, all about a Hmong mother who had a daughter who had seizures and who she basically wore on her back for her like whole life. And they talked about the health equity challenges and the surprising answers and the ways that assumptions enter into things. And I think that pharmacists are really good at getting to the root of a problem. So like for that instance, the medication instructions that may have been very simple for other people to understand, the way that that mother understood them, she just was like, oh, okay, I only have 15 pills. I will, take that over the course of 45 days. But that didn't make the medication effective. But pharmacists are really skilled at explaining things so that patients understand why they need to be adherent and addressing concerns about adverse effects. And those are very basic population health things that pharmacists do just because of the nature of their role. But they do a ton of other work as well. Former board member Pam Schweitzer with the Public Health Service Corps, having pharmacists in that role to understand what medication population health looks like, right? How do we increase access to medications across the population? And unfortunately, we live in a very inequitable healthcare system right now. And there's a lot of hardworking people who care a lot about making things better. And pharmacists are, right at the front lines helping with that.
Yeah, I completely agree. And I think that we could probably talk about this for a lot longer, but we only have a little bit of time left. And I want to make sure that we touch on the Emerging Professionals Fellowship, because I would love to hear what your experience was in that role. It's actually open for applications right now. So tell us a little bit about what you enjoyed from that role and maybe what kind of members you would recommend to apply.
Yeah, really I'd recommend any member who's qualifies for the emerging professional to apply, honestly. I think that there are so many great opportunities that exist at NCPDP, and Emerging Professional Fellowship was one I took advantage of. One of my colleagues and now good friends, who was the fellow before me, said, you should apply for this. I really enjoyed it, and she really enjoyed the strategic planning committee aspect of it, and so did I. And I think overall, I enjoyed getting to use my voice in a way that wasn't the same at a task group level or a work group level. And it was a sandbox that I can play in that was really gentle and kind. There wasn't a wrong way of doing things. And I think a lot of people, and we've talked about this a lot, think emerging professional and think that, oh, it's only for people earlier in their career, but it's for people who are newer to NCPDP. And it was a really, I think, honestly, the best way to get face time with leadership, both who are staff at NCPDP and who are other leaders at other organizations. There's lots of speaking opportunities, really a lot of skill building that the fellowship provided, and it's as much as you want it to be. So some have not had maybe as much capacity as I had within my day job to dive in, but I valued the opportunity so much that I wanted to say yes as much as was feasible, and really enjoyed getting to know what strategic planning meant to NCPDP and what member engagement meant, and I think I developed relationships even more broadly across the member groups as well, and learned more about standards or areas that I wouldn't have necessarily been plugged into from my day job.
Mm-hmm.
And it just really expanded my mind. And I love the emerging professionals group as in general, but the fellowship also just gave a structured format, right? And I think that a lot of times people don't have structured programs in their day jobs that they can utilize for leadership development. And so it was really exciting to have the opportunity to have that structured program to use.
Well, thank you so much for sharing that with all of us today. And before we wrap up, I'm wondering, let me see, I like to sign off with like a fun question. So can you share with me your favorite memory from during your fellowship?
Oh, man. That's a good question. I think like right as my did I win the Rising Star Award
did.
during my fellowship? I feel like
Yes.
that's probably my favorite memory.
Yes, you did.
Yeah. That just sounded like a total brag, which I don't like.
I love that. You should brag. You earned it.
Yeah, I'm really proud to win the Rising Star Award. And I felt it was, you don't get many opportunities to be in front of a large crowd and to thank those who make things possible for you. None of us are one-woman teams who do it all alone. And I think that's really why that was special too, along with the Emerging Professionals Fellowship, is that, yes, I was the fellow, but one of the things that I love about the fellowship is that you spend 6 months with the previous fellow and then 6 months with the new fellow. And in that way, it just made things that I knew that I was taking on someone's legacy and then leaving a legacy moving forward. And, there's not that many opportunities in your career to dive into that. So I think that was why that was really special.
And a wonderful legacy that you left. So thank you for participating. Thank you for joining me today.
That's a wrap on this episode of NCPDP Unscripted. Thanks for joining us as we explore the voices and ideas driving innovation in healthcare. If you'd like to be a guest on the show or have topic ideas you'd love to hear us cover, we want to hear from you. Until next time, stay curious, stay connected, and stay unscripted. Our podcast is proudly sponsored by Marks Productions.